Hi, I'm Dr. Reed, and I want to talk to you a little bit about, of all things, Ebola virus in domesticated animals. And there is a lot of information out there, and it can be very confusing, so I am certainly not going to act as an expert, but I will tell you that there's a website called VIN, or Veterinary Information Network, that has a tremendous amount of good information on this disease, and experts that are responding constantly to questions. So I'm going to actually read a couple of statements from this. I will say that at least in our part of the country, unlike in Dallas or perhaps Ohio, we are far from any human that we know of at this time having Ebola, and dogs are not at risk, at least in our area. But I'm going to read a couple of statements from the Veterinary Information Network, and a place where I think that you can go to get some good current information from the CDC that I'll give you in a minute. But let me read. Currently, there are no guidelines for what to do with the dog that belongs to an Ebola patient. So that is rather frightening, but it is a situation that we have never been in before, and currently there are no active guidelines. But a comforting thing from one of the experts on VIN was this: there is no evidence that domestic animals play an active role in the transmission of Ebola to humans. Again, the key part of that, there's no evidence at this time. This is an incredibly fast-moving story, and the website that I would send you to is the CDC website, and the section is questions and answers about Ebola and pets. And I just checked it 5 minutes ago, and the most recent update was on the 13th of October. So that's about a week old, so I would check that constantly because this is a rapidly moving story. But there's no need for concern, but there is a need to be aware of what's being said and that what you're hearing is accurate. So although the CDC has had some problems in managing this, the Veterinary Information Network, that I think is a very credible source, is advising us to tell our clients to go to the CDC website for their recommendations. So again, this is something that I'll try and update frequently as I know things, but I am certainly not an expert, but I do know of some good places to get the most current information that there is. So thank you very much.